Transferring critically ill patients is often complicated by the use of equipment which we're unfamiliar with. It's stowed away in cupboards and has difficult checking procedures. One of the commonest incidents reported is that of battery failure. By way of illustrating the importance of checking equipment, I'm going to use the LSU suction unit. Here it is, as it were in a store cupboard, plugged in, indicating that the power is on. Turn it on, and it works absolutely fine. However, if we were to go on a transfer, unplug the machine, the patient needs suctioning, the machine fails to work. But if we go right back to the beginning, plugged in, see the power light is indicated, the battery is trying to read, and straight away you can see there is no battery on board. Turn it on, it works absolutely fine, but actually it's never going to work in the transfer state because there isn't a battery. And the machine is telling us this. With the battery on board, plugged in at the mains, the machine will read the battery charge and give you an indication of what the battery is. Turn it on, it works absolutely fine. Unplug it, and you can see straight away that the equipment, when turned on, will work and give you an indication of what charge status the battery has. This machine has only one button and a test button, and yet it's quite complex. Imagine now your monitor or your transfer ventilator, which has numerous buttons and numerous soft keys and menus. The checking procedure is paramount. So this is the transfer ventilator, a very capable piece of equipment, essential for transferring critically ill ventilated patients. It has many safety features, including oxygen and battery readings, that will indicate to you how you're doing and how the patient is doing and how much time you have left on the transfer for those kind of equipment issues. And remember, if this piece of equipment were to fail, the Mark I ventilator is always available. This should be connected and ready to go in the top of your transfer bag or near the patient's head. It should have the connections available for the patient, not done up and sealed away in a bag. The other thing to remember with this is the patient needs to be stabilised on this piece of equipment 20 to 30 minutes before you leave your department in order that the patient becomes comfortable. And check a blood gas before you leave. One thing also that people get stuck with is how to change a cylinder. With the Schrader valve, it has a little collar on the neck which twists, that unlocks it. To plug it in, there's a U connection which goes to the 12 o'clock position and you push until it connects. An essential part of any critical care transfer is the monitoring of your patient. Transfer monitors are many and various, and this is one that you'll probably recognise. The key thing to remember about it is if this piece of equipment were to fail, as long as you remain vigilant and observant of the patient will come to no harm. You are the most important monitor on the transfer. There are some key things about this. It has a battery indicator that tells you how the battery status is doing. Remember, keep this equipment plugged in until the very last moment before you leave. That way you can ensure the status of your battery. Batteries can be changed. This one here has it on the side. Each piece of equipment is slightly different. Can't emphasise enough though, the most important monitor on the transfer is you. So with your infusions, typically infusion devices, we have many on intensive care units and you might have many on your patient. You need to rationalise which ones you're going to use. Things like potassium, background fluids, stuff like that doesn't need to be for the transfer. What you need to consider is, have I got a spare one? Is the one I'm using working? And is the infusion going to last the length of time that the transfer lasts? Volumetric devices such as this top one here are not recommended for transfer, and you'd be better off with an infusion device that runs off a syringe. The battery life on these is usually quite good, but be aware and make sure you always have a spare. We've already talked about the LSU in some detail, but if this equipment were to fail for whatever reason, it wasn't working, the patient needn't come to any harm if they have the need for suction. Patients are liable to increased secretions due to the movement of transfer, and a handheld sucker is an essential part of your transfer bag. Remember, however, it doesn't come ready-made up. You'll need to make it up when it comes in the bag. So ensure that you're prepared for any eventuality. You've got all this equipment, you've got your patient, you need to load them onto a bed or a trolley. Where are you going to put it all? So we've covered some of the common pitfalls associated with transferring critically ill patients and the equipment that you might use. Remember, if you do have an incident, document it. It's essential. And most important of all, our challenge to you is, how well do you know your equipment?